Hello, thank you very much for your interest in my video. Stay with me till the end, and I will show you an excellent opportunity to earn a lot of money in addition to whatever you are doing in your life at present. I invite you to consider and join a brand new profession, that of a dental health promoter. As I go along, I will convince you that it's the best profession to take up at the moment, and you will be very happy having joined it. Before I go further, I would like you to understand dentistry in India and as it is practiced in India. There are more than 3 lakh general dental surgeons in India and more than 50,000 dental specialists in India. Also, there are 300 dental colleges which produce over 30,000 dentists every year. The jobs are very few, and most of them have to start a dental clinic of their own to earn a decent living. Now, there are two types of dental services available in the country in the private sector. One is the large number of corporates with big money from foreign investors who have entered the markets in India. And the other is the stand-alone dental clinic that is run by a single dentist. Now, the interesting part is, although there is a big corporate entry in this Indian market, 95% of the people still attend to dental standalone dental clinics. They find them more reasonable and therefore they attend them. Also, these corporate dentists are available in large cities only. But the dental clinics that are run by private enterprises or entrepreneurs, they are always in need of more and more patients. Dental clinic is a very expensive education, and so is the opening of a dental clinic. This high cost is met with very little awareness of dental practices or dental services to the general public. The earnings of Indian dentists from Indian dental clinics, and Indian dentists earn much less than the dentists in foreign countries. Also, the number of patients in an Indian dental practice is much less as compared to that in their Western counterparts. However, interestingly enough, 95% of the work that is carried out in dental clinics is preventive in nature. That means if the patient is seen in time, you can get a very reasonably priced dental service, and the treatment is not allowed to go out of hand, or the problem is not allowed to go out of hand. You must understand also here that the dental disease, as it commences, is a silent disease. If something is happening even in my mouth, I am a dentist with 46 years of standing, I will not be able to discover it till my colleague dentist takes a look at me and examines me properly. Yes, even dentists have to go for regular dental checkups. Once regular dental checkups are carried out, a patient is told of the dangers or the problems which are arising or have started happening in the mouth, and appropriate action can be taken so that things don't go out of hand. At least a checkup once a year is absolutely important to see that you stay in good dental health and don't get into big trouble. Unfortunately, this is not the practice in our country. Most people go to the dentist only when the problem is very big, and at that point of stage, the treatments are very expensive and they also have to suffer a lot. See, the only way dental health is promoted in India is through the good offices of the toothpaste companies. Of course, they are doing it to increase the sales of their products. And I think that is very fair. They're doing it for themselves. But brushing at home is just home care. It is not dentistry. Even if you're brushing yourself every day, you need to go to a dentist regularly. It's like, I tell you an example. You clean your vehicles every day, but still you need to take them to the garage once in a while. You need professional care. Now, dentists are trained and have excellent training to look after your dental needs and oral needs, and they can definitely help you keep your beautiful smile intact. But unfortunately, even our medical colleagues are unaware of the scope of dental treatments available to them. Now, to promote themselves, most dentists and even the corporates now conduct dental camps and offer free checkups. Also, they offer discounts to patients on treatments. But these are of little value. We all understand that anything given free doesn't carry much value. We all look at an announcement and then just turn the page away. So, who wants to go and look at something for free? But even with these drawbacks, that is, less people going to dental clinics and all that, and less awareness, a report in 2014 valued the Indian dental care market at 2 billion US dollars. Now that amounted to 14,000 crore rupees. It was also stated that the market will grow at 20% per year. Now, at that rate, in 2021, the market now stands at $4 billion, dollars, or let's say 28,000 crore rupees. And mind you, it is growing. And all this is happening when people don't visit the dentist regularly. If the people are encouraged to visit the dentist on a regular basis for their own good, then the value of the dental healthcare market, or the dental healthcare economy as we call, would increase 3 to 4 times to 84 to 112,000 crore rupees. That, believe me, is a huge market waiting to happen. Now, the dentist on his own is not in a position to step out of his clinic and go and look for patients. He requires help. This huge market is now ready to take on partners. A dental health promoter can become a bridge between the dentist on the one hand and the public on the other side. This is where a dental health promoter can earn up to 20% or more by joining up as a dental health promoter. You need to attend an online course and, armed with the knowledge, step into this brand new profession. It would be not out of place to give you an idea about the common dental problems that are most common, and also the treatment charges for them. Mind you, this is not a comprehensive list. I'm only going to give you an example of two conditions that happen very, very commonly in our country. One of the most common factors is gum disease. 90% of the population suffers from this. Most people refer to YouTube videos which advise washing or rinsing the mouth with fitkari or alum as it is called. Now, mind you, if you want to do it, you can do it at the risk of your own teeth. But that is not what dentist is about, because if that is what treated people, you wouldn't be attending a 5-year course into good dentistry. Now, a dental clinic run by a qualified dentist and well equipped would charge between 1,000 to 1,500 rupees to clean out the gums and the teeth. But if this procedure is not taken and not done, then the condition deteriorates and it becomes worse. When it becomes worse, what you get? You get more swelling in the gums. The gums start bleeding all the time. Even when you talk or you eat something, they're bleeding. And at the same time, what is happening is, next stage is pus forms in the teeth and the mouth starts stinking very badly. At this stage, simple cleaning does not help. What is required is gum surgery, and that the cost of the gum surgery can be as high as 25 to 30,000 rupees. Now, what could have easily been handled for 1,015 rupees now requires 25 to 30,000 rupees to save your teeth. Similarly, another common problem is decay in the teeth, and mind you, more than 70% of people in this great country suffer from it. Now, the treatment is, in the beginning, is just a simple filling. A filling would cost you anything from 1,000 to 1,500 rupees, depending upon the size and the location of the filling on the tooth. But if allowed to progress, it becomes very big, the cavity becomes big, the tooth becomes very painful, and it can then not be treated just by ordinary means of a filling. It requires something that is called a root canal treatment, and that costs a lot of money. A good doctor or a senior doctor with even a microscope as an adjunct in his practice would like to charge something like about 9 to 10,000 rupees per tooth for a root canal treatment, and that will require a crown or a cap on it, which is mandatory. You have to go for a crown and cap, which will again require anything from 1,000 rupees to 9 to 10,000 rupees per tooth. Now you can see, if you delay, if you don't take treatment, you can be in a lot of trouble so far dentistry is concerned. I told you all the procedures, or 95% of the procedures, are preventive in nature, and prevention is the best form of existence. You prevent a disease instead of having to suffer it. A dentist can engage as many numbers of dental health promoters as he wishes to have. Why? Because he doesn't have to give them a salary, he doesn't have to provide them office space, he just has to have them associated with them, and they earn only purely on performance. The harder they work, the more they earn. This will give you an opportunity of the opportunity that awaits you as a dental health promoter. It's a golden opportunity. So the question that arises is, who can join as a dental health promoter? Literally anyone can join. Yes, you heard me right. You could be doing anything in life at all. You could have any education, any job, any age. Students, housewives, insurance agents, nurses, teachers, voice boys, assistants in medical practices, beauty parlor owners, just about anybody can join. You can do this in your free time in addition to whatever you are doing presently in life. All you need to do is a desire to learn a little and earn big, very big amounts of money. It will cost you a small amount to enter this economy, which is growing at 20%. Click on the link provided for a golden future as a dental health promoter. I'm sure this video was worth your time. Thank you very much for hearing me out patiently.